Say it for the cam. Say it for the cam. You said what?
I can't wait to be in pain so I can have these small boobs.
Okay. Y'all remember that? Y'all remember what she said? She said she can't.
Out.
Y'all remember that? She said she can't wait to be in pain, and I'm gonna come back on Thursday night.
Alright, hey you guys, so as you guys can see, I am in the parking lot. I have my equipment and I'm gonna be doing pre-op, so I'll see you guys later. I'm about to do blood work right now.
Alright.
Does it need to go
This
big
a
again?
little bit. Well, actually, never mind. I put right under. You're fine.
Okay. For this part I'm nervous.
For this part, okay, go ahead and just sit back.
Is it this one or this one?
Well, I have to see first. Let's see. Let's see first. You have a good bit. You're fine. Go ahead and go ahead and put some pressure right there. That's it. It wasn't bad.
Okay, you guys, I'm nervous. I'm not a blood person. Dr. Sean coming in this office?
Hi, Dr. Simon? Yeah, it's on the next, like on the
Do you guys
first
call him Dr.
three rows.
Sean Simon, like his full thing, or
No,
just
Dr. Simon.
Dr. Simon.
Dr. Simon and Dr. Young.
Okay.
No, if I say Sean Simon, I think he's gonna think I'm mad at him. It's one of those things that only your mom calls you by like
Full
your
name.
first and full name. You're
Yes.
in trouble. You're fine. All right, now let's see this one. You have nothing.
I know, I just
Not
did.
even a little drip.
Thank you.
You're welcome.
Oh, I thought I was going to take it over. I can't see it.
Let me just take your weight in the next room quickly, and then we'll just bring it back in here.
Oh, my what?
Your weight.
Oh,
Very
yes.
quickly.
Is it going to be in the room?
Right here. No, I'm just gonna have you sit on the floor.
Okay. Hold on, you guys. I'm just going to go ahead and take my weight. I'll be back.
There. All right, Milo. You can have a seat here. I'm gonna let Dr. Young know you're ready, okay?
Okay. So I'm seeing Dr. Young first?
Yes, you will receive Dr. Young.
Okay. I just finished getting my blood work. I mean, you guys already saw, already got that. I came a little bit late, about 10 minutes, but this is the office. A little bit similar to where I was last time. So the reason why I didn't step on this scale, I guess it has low battery. But I was able to go ahead and just step right next door to do the manual one to check my weight. All right, so Dr. Young is gonna be coming, and then I'll see Dr. Simon. All right, so we're just gonna go ahead and wait for him. Really excited, really excited. All right, so you guys, I don't think I've ever actually shown you guys my boobs, but this is me. Look, do you guys see this? Like, my waist is like, it's over here, but you can't really see it. So this is all F. If you saw my last video, you will see this is actually only one bra, so it usually does look smaller, but that's because I'm wearing either a smaller bra or like I'm wearing a sport bra or something, so this doesn't match my body. And if you already have my Instagram, go ahead and follow me. I'm gonna go ahead and put it in my Jenn Notes. You'll see that I look much smaller, I guess, in the dress size area. Okay, so bad news, they just finished letting me know I am gonna go ahead and see Dr. Perry Young. So they're about to go ahead and do a physical right now. I'm gonna go ahead and do a physical, but unfortunately I can't go ahead and film it. So that's gonna be interesting. So the part that I can film is actually the day of surgery. So unfortunately I can't give it to you guys, but I will definitely go ahead and talk to you guys about what was said. See you guys. Just finished my physical with Dr. Young, which is actually the wife of Dr. Simon, so that's awesome. She was really sweet. And now I'm gonna go ahead and see my conductor, Alicia, and we're just gonna be talking about all the other stuff. I have to do my last payment, which was the $200 for the blood work, as you guys saw, and now we're almost finished. I believe I just need to go ahead and see her, the conductor, and then Dr. Simon to just go ahead and go over what I want and whatnot. Alright, but we'll definitely go ahead and tell you guys about it in a bit. Alright, hey you guys. Alright, so currently I have the robe on. Sorry you guys, I cannot show you guys all of that. The video will be coming out when they actually show the pictures as well as the actual surgery. So I'm gonna go ahead and ask Dr. Simon if he will allow me to, but if not, they just told me when I got in that unfortunately we can't. It's all good, it's all good. Hopefully he says yes to it and you guys will actually be able to see it. If not, I will go ahead and just repeat everything that was said. So don't worry, I got it, and I'll see you guys in a little bit. Alright you guys, so I just finished asking Dr. Simon and he agreed. Thank you so much. And we're going to be doing the pre-op.
How are you doing?
I'm doing pretty good.
Yeah, so you're getting excited, right?
Yes.
Yeah.
I just finished changing it. I had it at May, but I changed it so many times.
Oh, okay.
It was due to job, but I'm at a new job, so
What's your date?
my date is actually this Thursday.
Oh, okay, awesome. No more time to worry about it then.
Yeah, so got to it.
Okay, good. Yeah, you'll see. I mean, so are you currently, something changed with work or whatever?
Yeah, something changed with work. I've been in this one for 2 months, but I let them know ahead of time that the other ones, I changed it for them twice. It was in January, then March, and then they declined both dates, and I was like, what?
Are you serious?
Yeah, so I was really pissed.
Are you working, like, in an office, or what's it like?
Yeah, now it's a rehab center. So,
Oh, right, okay, so you're doing mostly, like, you're in person, like, not,
I'm in
yeah.
person.
Okay, right, so it obviously makes it a little tougher as far as, like, getting back to work quickly.
Yes.
Yeah, a lot of patients are working from home now, so they're, it's like easy. You do a surgery like this, you could be back in the office, or back, like, on the computer working, like, in 1 or 2 days. So, okay, so how much time, what's your time frame, or what's your thought as far as taking time off?
Yeah, I let them know I'm gonna take at least 2 weeks.
Oh, okay.
So
That's good.
That's pretty good. So
Yeah.
just gonna relax.
No, that's good, actually. I mean, I'd rather you have enough time to, relax and recover in a sort of like a nice stress-free environment versus like being back at work too early.
Mm-hmm.
And by 2 weeks, you'll actually feel really good. Remember, I told you
No,
that this,
I heard. So I was just like, okay, that's at least good. So I wanted to take an additional week.
right?
That's the case.
Yeah, and then this, like you'll see, probably if you remember what I explained in the consultation, that this surgery, despite what, you might have believed, or a lot of people sort of like come in thinking, is that it's really not a very painful recovery at all. So you'll see, you'll recover pretty fast from a standpoint of like being comfortable and not being in a lot of pain. So by a couple weeks, you'll be feeling really good. Okay.
I was worried about the scarring because I know how I'm doing the anchor instead of the
Yeah, well, so the way I kind of handle that is, there's a couple things. First of all, the type of incisions, of course, are dictated by like how much tissue needs to come out, how much skin, things like that. So, I always try to keep like the shortest scars possible, the least amount of scars possible, but still get the result that we want. So it's kind of always that balance.
Yeah.
The last thing that, like when I'm doing these surgeries, the last thing that I'm kind of considering, or the last thing that I'm marking, is the bottom part, or that, the sort of like the bottom part of the anchor and type incision. So I always try to keep that as short as possible. So, in other words, like I want to keep it so it's like hidden sort of underneath the crease of the breast, versus like it's not going to be extended out long. So I don't want anyone to be able to see it, like whether you're wearing a bathing suit or type of bra or something, like where it extends out past that. So we're going to keep it underneath the breast.
Yeah,
so I'll always try to keep that as short as possible.
No, that's great to know. I was just talking to Alicia about the side boob, and I know it's still part of the boob, so that will be taken care of.
It's also going to everything's going to get shifted over too. Like, so even when there's like a lot of tissue here, like when the breast gets lifted, it gets lifted up and in. So like all this, and I'm sure, like a lot of women that are looking for breast reduction or whatever, you've probably done this in the mirror where you kind of like pull it over and you feel how much this tissue kind of like disappears, so it's going to help that whole like upper flank area also.
Yeah, no, I literally just finished doing another YouTube video because I was trying to see if I was still the same size, and I don't know what happened, but I'm no longer triple D, now I'm an F. So
I mean, those sizes, I mean, they don't mean that much, to be honest with you. I mean, like, you actually did you do like your own measurements or something? Or?
Yeah, I did my own measurements because I already let her know that I was doing YouTube, so she let me do it. But yeah.
Oh, this is like in a store, you mean, or something?
Like,
oh, okay.
Right.
Yeah, and it also depends where you go to. I mean, I guarantee if you go to 3 different stores that have different manufacturer bras, like they're gonna tell you 3 different sizes, you know? Victoria's Secret is always going to be like multiple sizes bigger because their bras kind of are smaller. Yeah. So like you might be a D somewhere and that triple D there.
Yeah, I don't even use their bras. It's too small.
Right. Yeah. So I mean, right, because a triple D at Victoria's Secret is like a C somewhere else. I mean, so they're the sizes are like, you know, they're not terribly useful. You know. Yeah. Triple D, F, whatever. It's a big breast. I mean, doesn't really matter. Okay. What would you say is your goal as far as if you could put it in terms of a cup size? I mean, since that's something.
That's what I was gonna ask.
Yeah.
I was trying to see either a C or a D. Since I'm like an F, like I really like when I was.
I think that's pretty reasonable, you know.
Yeah. But I wanted to know which one would be better for my body because I've seen some C's that I think look, you know, magnificent, but then like is C too small?
It's different for each person's body too. I mean, like, and again, you know, since cup sizes they're not real measurements of size. It's not like in this type of surgery we're going to sit there and, you know, there's not like a device we're going to use and be like, okay, well now I've removed enough and this is a C cup, this is a B cup, because there's no such thing as like a standardized kind of size. So the idea is to obviously make it a lot lighter, a lot smaller, perkier, and something that's proportionate to your body. So that's really the goal. Whether it's like a C or a D. You know, probably you'll fit in some C's and some D's. I mean, it just depends on the bra.
Yeah,
you know?
as long as it's not a double.
No, it's going to be a lot lighter and a lot smaller. Yeah, of course.
The other one. So is that kind of like a breast lift since it's taking...
absolutely. Yeah. Breast reduction is always a breast lift also. Yeah. You want me to kind of show you again, or?
Yeah. And I don't know if you can also show me like I know that we were looking at pictures before, so I can have like a better idea.
Sure.
Of, like people that had like triple D's or F's, and then they went down so low.
Right. Let me just show you. So what I was kind of explaining is that the idea here is that the breast, of course, is a lift also, right? So one of the benefits of the lift is like, see all these stretch marks and everything on the upper part? They're pretty light actually. So if I take your skin and just kind of like, I'm just going to demonstrate something. See if I stretch out the skin, how they basically disappear. Okay, so when you take stretch marks, especially these sort of narrow, light ones, and you stretch the skin out, look at that. It's like they disappear. We're not removing the skin from up here, but those stretch marks will look like they're gone because the skin will be firmer. Okay, and of course the nipple and areola is moved to a higher position. I take out the tissue from this area here, so it's sort of like all this lateral part in here, and preserve all of this. So what happens is the nipple and areola rotate up to a higher position. It's hard to demonstrate, obviously, because it's going to look smaller than this, but the breast is going to be way up high, you know, it's going to be perkier. And then like this area here, you can see how that gets like, all this gets pulled up and in, so it really helps this whole upper flank area too, okay? Does that kind of make sense?
Yes.
As far as, I don't know if this is on right now, but Alicia can show you a bunch of stuff too.
Awesome.
Yeah, she'll have to get that fired up. But I mean, the idea is obviously, I mean, you have a good symmetrical kind of shape now, you know, so in other words, the breasts are pretty equal. So the idea is obviously have a perkier, lighter version of that. Okay?
That was it.
Alright. And you have no more time to worry anyway. A couple days away.
I know, it's just like, and I just finished doing the blood work.
Yeah.
I'm surprised I didn't cry.
Maybe not a fan with needles?
No.
Yeah, that's fine. That'll probably be the worst part of your day then, you know, is like just getting the IV. But Priscilla, she'll put that in 2 seconds. I mean, so.
That was the other question. Was it going to be done by IV or am I going to be?
Well, you'll get both. I mean, so you'll get an IV beforehand, you know, just like any procedure. So they'll put a little IV, but it's no worse than getting a blood draw.
Yeah.
Yeah, you'll see it's nothing.
I think that was like the worst part because this is my first surgery, so I was a little bit, actually no, I'm still freaking out about what just going under. I'm sure a lot of people
That part, yeah, a lot of people are more nervous about that than the actual surgery. You know, especially when you've never had it before, but you'll see after this experience, the next time you need surgery or have surgery for something else, you'll be a lot less anxious, you know, because it's actually a pleasant experience when you undergo anesthesia. It's sort of like, you know, even if the surgery is 2 hours, which is probably approximately what it'll be, for you it's going to literally seem like this. I mean, it's going to be, you go to sleep, open your eyes, and you're in a recovery room, like, hey, are we done? And oh, it's all finished. I mean, you won't even understand like the passage of time. You won't hear anything, you won't feel anything. So then you'll wake up feeling pretty good and comfortable.
Awesome.
So it'll be like a great nap.
That's good to know.
Okay.
For the actual day of surgery, can I have 1 or 2 people that are gonna be like there?
Yeah, so, well, they won't be in the surgery room, of course.
Yeah.
Yeah, I mean,
But before.
yeah, I mean, they'll be with you. I mean,
Okay,
certainly,
good.
you know,
Okay, I
but
wasn't
what
sure.
we do is, you know, Alicia will kind of explain how that day will work, but,
Okay.
I mean, obviously, a lot of people come with a family member or something like that. Now, there is a stage where you'll be separated. Once we bring you into the pre-op room, we start getting you ready, then at that point, you know, they'll separate you from whoever you're with.
Okay,
But
no, that's fine. I just
sometimes family members wait, you know, sometimes they don't. It just depends on what they want to do, you know, and then we just contact them afterwards when you're in the recovery room, because you'll be in recovery for about an hour anyway, so
Okay.
it just depends if they feel like waiting out there or just going home,
Okay.
you know, depending on how close you are or whatever.
Yeah, I'll probably just have my mom and my sister. The other one's at work.
Okay.
But yeah, I just wanted someone there first. And then
Yeah,
go.
sometimes, honestly, sometimes these family members make patients more nervous, especially parents.
No, my mother, she actually had a breast reduction.
Oh, she
so
did?
She's
Okay.
been.
So she's
yeah,
pretty
just-
calm about it?
Yeah, she's just like, you're gonna be okay.
Oh, okay, all right, that's good, yeah, because sometimes they're like freaking out and, you know, they make, and the patient's totally cool and their parent or something is the one making them nervous. Any other questions?
Yes, you talked about other surgeries, so I was interested maybe after this one, or maybe after losing a little bit more weight. I was close to 300 pounds, so
What's your current weight?
I'm 240 right now
Okay.
that I just finished checking, but I was almost 300, and I have all of this.
What would you say is your goal? Like, what's your weight goal?
My weight goal would be around like a 190.
Okay.
And I was trying to do the military, they wanted me to go down to 170, but my
Oh, really? They gave you like a specific number?
Yeah, they wanted me to 170.
How tall are you?
I'm 5'8".
5'8", 170. Yeah. So you know, I mean, the arms, you know, it kind of depends on how the skin recovers. A lot of times I'll try to do something minimally invasive like laser assisted lipo to reduce the arm size and then, you know, take out the fat, shrink and tighten up the skin without actually making an incision. But sometimes when there's a lot of loose tissue, a lot of loose skin, which can often be the case, especially after a lot of weight loss, then there's a procedure called brachioplasty, which is an arm lift, where it's like an incision that goes down the arm,
Yeah, I've seen that one.
take out a lot of skin and fat, etc. And so that's something that I do fairly frequently.
And do you know how much that usually ranges if I do one?
I mean, Alicia could give you that information for sure.
Okay. So yeah, I think those were all of my questions that I had. Oh, but for my body, do you think I will range more to a C or D?
Again, you know, it's very hard to predict the cup size, you know.
Right.
And again, I don't really care what the cup size is. I mean, I just wanted something that's going to look good, proportionate, you're going to be happy with. Obviously, it's going to alleviate a lot of the symptoms that you have from having big, heavy, dense breasts.
Yeah.
You know, like this. The first thing you're going to notice, other than obviously that they look very different, is literally the day after surgery, you'll probably walk in here and comment about how your neck and back already feel
because I
better.
have so much of the dark
Yeah.
brow lines.
Right, where it like digs into the shoulder, yeah. So all that is gonna be, you know, I mean, of course, that'll take time to go away, but like the feeling of that stress on your neck and shoulders is gonna be really pretty fast as far as what the relief that you'll feel.
I can't wait.
Okay, all right, so we all set. Did they take your photos already? Or?
Yes.
Okay, all right, good. So then you can go ahead and get dressed, and then Alicia will come get you, and she'll finish going through all your stuff, make sure you get all your medications, your instructions, and everything, get you ready for Thursday, and we'll be all set to go. Okay?
Yes.
All right, we'll see you Thursday. Okay, all right, no problem.
Bye.
All right, so get dressed right here. She'll be with you in just a second.
All
okay?
right, sounds good.
Okay.
All right, so that was awesome. That was Dr. Sean. I'm so super excited that he was actually able to go ahead and do the video with us. So super sweet. Hopefully we answered a lot of questions. Those are just the questions that I had in my mind. Yeah, let me cover up right here. But let me go ahead and get dressed. Alicia, my conductor, she's gonna go ahead and answer some of my additional other questions. As you guys saw, I also wanted to go ahead and get another surgery. We're gonna go ahead and see how that goes because I still do have to lose weight and it's gonna take about 4 to 6 weeks. of me not exercising. In 2 weeks I can do light work, but knowing me, I'm not gonna go to the gym for at least 4 weeks, and I'm just gonna have to be eating right. So again, let me go ahead and get changed up, and we're gonna go ahead and do that. I don't think Alicia will go ahead and show me the other stuff, so I'll go ahead and tell you guys what we spoke about, but I'll see you guys later. Alright you guys, so this is just a close-up. I just finished putting on my bra. As you guys already saw in the other one, you guys see me just wear a bra. Like, this is too much, you guys. Like, you guys don't even see like my waist or anything. Like, you guys just don't see it. It's just huge. So let me go ahead and put on my clothes and you guys will see it. Alright you guys, so literally just finished putting on my clothes. As you guys can see, I think I already shown it to you guys. This is how my boobs are looking. So again, you can't see my actual just like curve. Don't mind all of this. I just can't wait to go ahead and start wearing appropriate clothing that match my body. All right, and again, sorry for no wearing of the makeup. I really did not have time, especially since I was like 10 minutes late, but it is fine. Hopefully she lets me go ahead and film all the other questions that I had. In here, she's just gonna turn it on and she's just gonna show me different types of breast, usually from my F or triple D, since I was just that not too long ago. And thereafter, if they went down to a C or D, so I can see which one's gonna be better for my body and kind of just like imagine, even though Dr. Simon does not know exactly like what cup size is gonna be, hopefully it's gonna be ranging from there and it will fit my body. Okay, so that's literally the only thing that I'm like worried about, but not really worried about, because I know he's gonna do a great job. As I already mentioned in my other videos, he is double board certified, and I liked all of the pictures that he has under his website, which I will also be posting under my Jenn Notes, so go ahead and check it out. So just finished getting out of Dr. Simon's office. I have all my equipment. They also gave me some great stuff that I'm about to go ahead and show you guys, like scar cream. I need to go ahead and get my prescriptions right now that I have to go ahead and start taking. I believe one of the ones that she already sent me is that I can use right now. I'm close to my car, so I'll be just explaining a little bit shortly on what that is. Right now I am in the parking lot, so looking for my car. Super excited, you guys. 2 more days. All right, hey you guys, so don't mind the hair, literally just finished scrunching it up. I'm about to go ahead and go to my Walgreens right next to me. I have to go ahead and get a bunch of prescription. I have actually 5. I'm just so excited. I'm not gonna go ahead and be overwhelmed. As you guys already saw, it is going to be, hopefully, actually no, it's going to be a great surgery, and literally in 2 days I'm gonna go ahead and get the surgery. So excitement. Okay you guys, I'll go ahead and see you guys later. Alright, so I have my folder here. I just finished getting to Walgreens, so you guys do see it over here. So I'm about to go ahead and get in. Hopefully these prescriptions, I'm not sure if it was included or if I'm gonna have to pay out of pocket. I'll probably go ahead and do another video for you guys on how much exactly have I paid for surgery and everything included, because I know that I still have to go ahead and get the bras. I'm gonna go ahead and show it to you guys. Alright, so I literally just finished getting out of Walgreens. I was a little bit, actually no, I was a bit annoyed. The guy that was supposed to go ahead and get me my prescription was, I don't know, he just had an attitude on, like I would have to go to another Walgreens to get one of the prescription, and he kind of just made it seem like I was a drug addict. And I was like, what? Okay, all right, awesome. So I guess I'm gonna have to go ahead and get another Walgreens just to get, yeah, just to get one of the prescriptions. So on top of going at 1 to pick up one of the prescriptions at 1, I have to go to another Walgreens. So let's see how that goes. This is the stuff that I got from Walgreens. I was able to go ahead and get my 1 a day. So unfortunately I can't take my NutriBurst because that's one of the things that I can't take, being that it's a herbal supplement. And this is what I'm gonna be taking a shower with for tomorrow, as well as the day of surgery, which is Thursday. I believe it's a hip cleanse, and yeah, it's exactly what it says. So this is a soap. That's gonna be how it looks. What else did I get? No, that's for me personally. And then these are the prescriptions right here. I have about 5. They put it in about 3 of the prescription bags. And then right here is what they ended up giving me. So I have my folder right here that I was telling you guys about before. I already had opened it. Yeah, I already had opened it. And this is just basically saying all the stuff that I need. This is the day of surgery. Yeah, so this is just basically letting me know all of the stuff that I need to do prior to surgery. It's not that thick, but it definitely gives you like every type of surgery. Like me, I had the breast reduction. So if I flip it through here, hold on you guys. If I flip it through here, it's gonna talk about, it's gonna go ahead and talk about, you know, my comfort, medications, as well as like instructions. As I said, it has different surgeries. So for my breast reduction surgery, it just tells me like the surgical bra and what they're gonna be doing. Yeah, some of those are just different types. I also got this Silogen. So this is what I'm gonna be using as my gel for the scarring, but I have to get cleared for it. I can't do it right now. Hopefully it's gonna be in about a week. Post-op surgery. I also got this. This is the same brand as the gel, as you guys can see right here. But for this one, I'm so happy that she did it. So I start taking 2 days before. So I literally already took one this morning, and I'm gonna go ahead and take one later tonight as my second one. Let me see what else they have here. And it actually tells you all of the good stuff about it. Even though this is post-op, they told me to go ahead and take some right now. So I guess this is just all of the good stuff about it. And then finally I have my cute little magazine. So they gave me a bookmark. Let's see. Ooh, okay. So this is my Dr. Sean Simon, and like all of the works that he does. So that's awesome. So it has a couple of pages in regards to him.